Hello, bonjour, année, moitié. My name is Dr. Erin Pelche, and I'm a family physician with a special interest in cancer. I work for our Northeast Regional Cancer Program to be the voice for First Nation, Métis, Inuit, and urban Indigenous peoples. I've probably been to your community or have spoken to some of your health center staff since I started this work in September of 2019. I've heard from many people about what's important to them, and today, in this short video, I want to talk to you about what's important to know about screening for colorectal cancer. I've made these videos on different topics that you've asked to hear about, and I hope you find them helpful. Be sure to look for the rest of my videos about what is cancer and screening for breast, lung, and cervical cancer. I've also included how to get more information at the end of every video. Thank you. Merci. Miigwech. Let's start with what is colorectal cancer. Colorectal cancer is a type of cancer that happens in your colon and rectum when cells grow more quickly and differently than other cells. Your colon and your rectum are part of your digestive tract. Most colorectal cancers start as small growths, also called polyps, in the lining of your colon, where you can't see or feel them. Colorectal cancer is the second leading cause of cancer deaths in Ontario. And what concerns me is that colorectal cancer is more common in First Nations people in Ontario than among other people in Ontario. The death rate from colorectal cancer is also higher among First Nations people. One of the biggest risk factors for colorectal cancer is increasing age. This means that all men and women are at risk for colorectal cancer, especially once you are over the age of 50. Screening is the best thing you can do to find colorectal cancer early, when it's less likely to have spread and easier to treat. The good news is that 9 out of 10 colorectal cancers can be cured if they are found and treated early. Some people may be at increased risk for getting colorectal cancer because of their family history. What kind of screening you will have will depend on your type of risk. In Ontario, screening for colorectal cancer is done through the Colon Cancer Check Program. Let's look at risk a little more in the Colon Cancer Check Program. The program separates people into 2 kinds of risk. You are at average risk if you are 50 to 74 years old and you don't have a first-degree family member who has been diagnosed with colorectal cancer. First-degree family member means your parents, brother, sister, or children. Average risk people should get screened every 2 years. You are at increased risk if you have a family history of colorectal cancer in 1 or more of your first-degree family. If you are at increased risk, you should start screening when you are 50 years old or 10 years younger than the age your family member was diagnosed with colorectal cancer, whichever comes first. Let's look at some examples to help figure this out. If your sister was diagnosed with colorectal cancer when she was 43 years old, you should start screening when you are 33 years old. Another example is if your dad was diagnosed with colorectal cancer when he was 72 years old, you should start screening when you are 50 years old. So, average risk and increased risk people should both start screening at the age of 50 at the latest. Now that you know what kind of risk you have, we'll look at the kind of cancer screening test you should do. Remember that earlier we said that people at average risk and increased risk have different screening tests for colorectal cancer. If you're at average risk, it is recommended that you get checked with the fecal immunochemical test, what we call FIT test, every 2 years. If you are at increased risk, it is recommended that you get checked with a colonoscopy, at least every 10 years, and maybe more often. Your specialist will let you know. Let's take a closer look at these two different screening tests, starting with the FIT test. The FIT kit is a newer test, and it's much easier than our previous screening test. You don't need to stop any meds or certain foods. A FIT kit is still done at home. Your healthcare provider will order a FIT kit to be sent to you in the mail. If it's easier for you, your kit can be sent to their office or another address. With a FIT kit, you'll still need to collect a sample of your poop. A FIT checks your poop for tiny drops of blood that are too small to see, which could be caused by colorectal cancer or another kind of small growth called polyps. But this is now easier because it comes with a small picture guide, and included in the package is a thin piece of paper you can unfold and put on top of the toilet water. You then take a sample of your poop that is not touching the toilet water with the stick and then flush the paper and all down the toilet. It's even septic safe. Make sure you mail it within 2 days. It needs to be back to the lab within 14 days of testing. You and your healthcare provider will get the results in a few weeks. If your test is normal, which means no blood was found, you'll get a letter in 2 years reminding you to be screened again. If the test is abnormal, your healthcare provider will send you for a colonoscopy. Not all abnormal FIT results mean you have cancer or polyps. It just means additional testing is needed. We're going to talk more about a colonoscopy next and increased risk screening. Remember we said that the screening test for people at increased risk is called a colonoscopy. A colonoscopy is a test where a specialist looks inside your colon. This is done using a long, flexible tube with a tiny camera on the end. For your colonoscopy, you must prepare the day before by drinking a laxative, which is also called a bowel prep. This will help ensure your colon is completely empty and clean so everything can be seen during the test. Before your colonoscopy, you will receive instructions about what laxative to take, any medications you should stop taking, and what you can eat and drink. Your colonoscopy will also be done at a hospital or a healthcare facility. You may be given some medication to make the test more comfortable, so you need to have someone go with you to your appointment. During your colonoscopy, the specialists can also take samples of your colon if they need to and remove any polyps. Almost all polyps removed are not cancer. The specialists will also give you the results of your colonoscopy and tell you and your healthcare provider when you should have your next screening. Besides going for colorectal screening, something else you can do for your health is to know how you normally look and feel, so that you're more likely to notice any unusual changes. Some of these changes could be seeing blood in your poop, having new constipation, diarrhea, or stomach discomfort that lasts more than a short time, feeling like your bowel does not empty all the way, noticing you're losing weight when you are not trying to, feeling very tired that lasts more than a short time, which could be caused by a drop in your blood count. And finally, always remember that healthy living, like we talked about in my first video, may lower your chance of getting colorectal cancer, as well as many other diseases. I hope you'll take the next step and talk to your healthcare provider about colorectal screening. Thanks for watching. To get more information about cancer, colorectal cancer screening, or other programs, you can contact me at northeastcancerscreening@hsnsudbury.ca.